Greetings, you guys. My name is Latasha Frazier. I am presenting from Columbia, South Carolina. This evening, I will be speaking to you guys about the drug sertraline. Sertraline is used to treat depression, panic attacks, um, disorders such as SAD, GAD, OCD, and PTSD. SAD is social anxiety disorder. GAD is generalized anxiety disorder. OCD is obsessive compulsive disorder, and PTSD is post traumatic stress disorder. Excuse me. It also treats premenstrual syndrome for women that's experiencing major cramps, mood swings, or things of that nature during that time of the month. This medicine works well for that as well, for those symptoms as well. Sertraline has been around for quite some time now. It's considered a SSRI, which is a selective serotonin reuptake inhibitor. Um, uh, that's the class that it belongs to. It's also known as the generic name brands, which is Zoloft, um, Celexa, as well as Prozac. If you have heard those terms, that is also referred to as Sertraline as well. Is no single etiology that exists for this drug when it's treating general anxiety disorder, but it also increases major life stressors, such as like I stated, with general anxiety disorder, such as the fear of worrying, excessive worrying, the fear of losing a loved one, the fear of losing a job, the fear of losing money, anything that results in a major loss. That's basically what generalized anxiety disorder means, and that is what the sertraline helps treat when it comes to generalized anxiety disorder. The mechanism action of sertraline is presumed to be linked with its inhibition of the CNS, the neutral uptake of the serotonin. Studies at the clinical review sites states that relevant doses in men have demonstrated that sertraline blocks the uptake of the serotonin in the human platics. Basically, with the men, some men can experience side effects such as premature ejaculation. Other side effects that can be seen while using sertraline is nausea, dizziness, dry mouth. The loss of appetite may occur as well. Upset stomach, trouble sleeping. Trouble sleeping may occur, and then if any of these side effects do occur, you will have to go to your physician to seek help immediately. Sertraline works by affecting the balance of chemicals in the brain. Specifically, it increases the levels of the neurotransmitter called the called the serotonin in the brain. It increases the serotonin levels and help improves the mood to reduce the panic attack and treat OCD, GAD, PTSD, the disorders that I named previously in this video. There isn't a blood test that follows in order to get prescribed sertraline. You would have to be diagnosed with one of those disorders that I listed in the video earlier on, within the first minute of this video. Those disorders that I listed, those are the disorders that you will have to have in order to be prescribed the sertraline, or the Zoloft, or the Prozac, as well as the Celexa, which is the generic name brands that sertraline is also known as. Sertraline works missing doses, excuse me, with missing doses of, I'm trying to follow the questions that we had to answer in order to get full credit for this video. Missing doses of sertraline may increase the risk of relapsing in your symptoms. Basically, if you miss a dose of sertraline, you would have to basically be reintroduced to this medication. It's very important that you don't miss a dose. You will see the pill today. I will be showing it, so you will see how effective it could be, that you do not want to miss a dose of this medication, simply because your symptoms will come back, and they may come back a little bit more severe. You will start to see change within your body by taking this medication. Within 4 to 6 weeks, you will see fully improvement. Sleep, energy, appetite, you may show some improvement within the first 1 or 2 weeks. Improvement in these physical symptoms can be important as a earliest sign that the medication is working. So it's, like I stated, it's very important to take this medication on time and as prescribed. And basically you will see how to take the medication as prescribed by reading your medication bottle that will be printed with your name on it, and it will show you how often you should take the medication. The medication times and the ofteness of taking the medication may vary from person to person. I may have to take one a day as needed. However, someone else with more severe symptoms of any disorder may have to take it twice a day or a half dose a day. That all depends on you, and that time frame is left up to your physician based on the results of your disorder, whatever disorder that you have, and that you're taking the medication for. I'm trying to make sure I got everything on the sheet. There's no antidote for Zoloft overdose. This means that it can be done carefully by monitoring whoever that takes the medication, by checking their vital signs. I would say every 2 hours, check vital signs. Make sure they're eating. Make sure they're getting enough fluid so they won't be dehydrated when taking this medication as well. Make sure their heart rate is normal. They don't have any trouble breathing, and their blood pressure is at a normal number. That way, that can show that treating the disorder by taking this medication, that no more problems will arise. At this point in time, I will be showing you the medication. Let's see here. Sorry. I forgot where I put it. This is actually the medication. Sertraline is very, very, very tiny. I will attempt to take it out of this bag. It has it's green. It has the digits. Excuse me, my nails are probably too big for you guys to see. It has the numbers printed on it. 212. Excuse me. It's very small. Sorry about that. I don't know if you guys can see it. I don't want to drop it, but it's very small, a overlight pill. It has the, like I said, the numbers 212 on one side, and it has IG on the other side, and it basically has a bar where if you are prescribed to take a half a dose of this, it's easy to measure the half a dose, and that way you can actually, take effectively. You can kind of put your fingernail in it, or maybe take a small knife and cut it right where the line is. That way you can take the right amount of the sertraline, because you may be prescribed this pill. For instance, this may be 50 milligrams, but you may only need 25 milligrams. And since they don't make a 25 milligram pill, what you would have to do is cut this milligram in half by using that divider line that's printed on this actual pill. And you see how small this pill is for it to be as effective as it is. Like I say, with overdosing, it's very important that you take your medication as prescribed, because you don't want to overdose on something. You don't want to take it more than you need to take more than you need to. In order to for it to work effectively, you will have to take it as prescribed. And it's no way of treating an overdose, and an overdose could result into a seizure, or severe symptoms that you will maybe need another medication in order to correct. So it's very important to take medication as prescribed, not only sertraline but all medication, whether it is Prozac or Select, which is the generic brand name of sertraline. And I'm not sure if the generic brand names are smaller or small or the same size as this. I'm unsure of this, but this is the real pill that I wanted to present to you guys today. I hope you guys enjoyed my video. I hope I answered all of the questions that is asked for this presentation. And thank you for listening. Thank you.